Micropenis is a person who has with erection. The penis size is less than 3 inches with erection.
What is the cost of a penis enlargement surgery?
Anywhere between minimum 1 lakh Indian rupees, it goes on. It can land up even in 10 lakhs also.
Welcome to another session, and this time we are going to be talking about penis enlargement because we had a question in the last session, and we decided to do another session on exclusively for penis enlargement. And so let's start, sir. All yours.
Yeah, sure. So thank you, Jamie. Thank you for giving me an opportunity to address my esteemed colleagues and also those who are interested in the sexology field. So can the penis be enlarged is a $1 billion question. There are so many debates, yes, no, and there are very strong believers, even doctors. They say, they make such statement. See, the penis is the size given by the God. You can never change it. You have been blessed with such a penis, be with it. It can neither be enlarged nor be shrunk. This is a very rigid statement given by doctors, even very senior doctors also, even some consultants, not from the field of andrology, urology, or sexology, from some other sections. So they firmly believe that penis can neither be enlarged nor be shrunk. That is the old school of thought. Just like, say, about 20, 30 years back, if somebody would have told that, okay, cardiac surgery can be done without opening the heart, anybody would have believed? Even I would have said, no, how can you do cardiac surgery without opening the heart? Now, a small catheter inserted from the femoral artery, it will go do all the work and come back. And 30, 40 years back, if somebody would have told that through the keyhole, abdominal surgeries can be done, people would have just laughed at it. 40 years back, if somebody would have told that test tube baby can be done, they would have been thrown out of this one, medical field. So things do change. A lot of progress has been done in the field of sexology, especially the penile sexology.
Welcome to another session, and this time we are going to be talking about penis enlargement because we had a question in the last session, and we decided to do another session on exclusively for penis enlargement. And so let's start, sir. All yours.
Yeah, sure.
What is the definition of micropenis? What are
micropenis is a person who has with erection. The penis size is less than 3 inches with erection. With full erection, the size is less than 3 inches. And 3 inches to 4.5 inches, it is small penis. And anything above 5 inches, they come in normal bracket. So 0 to 1 to 3 are 0 to 3 micropenis, 3 to 5 small penis, 5 inches and above normal penis.
So they can't be...
And 6.5 inches and above large penis.
So someone with...
So this is the classification.
Someone with micropenis, can they not be produced with that size?
It is we can reach, but with stage by stage surgery may have to be done, just like orchidoplexy or any other surgery, cosmetic surgery. One day we may not be able to reach because there will be no enough tissue, enough corpus cavernosa, enough skin, enough nerves. So how much we can pull the penis, go on pulling it, it will cut, So the nerves get cut, So what we have to do is we have to do stage by stage surgery.
So the question,
for example, every 6 months we should go on doing this, repeat the surgery or the
So the question that I want to ask is, can somebody, let's say a micropenis, can they make children with that size, or is that a problem?
Yeah, usually they'll end up in infertility because they'll be unable to deposit the semen, required amounts of semen deep into the vagina. Most of the times they come with coital failure, ejaculation outside the penis. And in fact, that will be one of the cause for male infertility. So they really require treatment. And second thing is the female partner will not be happy with him. So that is the second indication. The first indication is he himself is not happy. Second indication is the partner is not happy. Third indication is they would have landed up in infertility also.
Got it, sir. So
that's a real medical indication.
Apart from this, there's no other medical requirement to enlarge the penis, right?
Yeah, peeing. Say some men with micropenis, they will be unable to pee in the public bathrooms or this one because the entire urine will be spilled on the pants, and other people will laugh at them. So, and they cannot expose themselves in the public urinals because the person who is next to in the urinal cabin, he looks at, hey, where is your penis, man? He has. So they become shy and they become depressed and they start worrying about their size. And for example, going to the swimming So if they put the underwear, if their penis is not seen, hey, what happened, man? Where is this one? The other boy, other person, they will just touch the couch and say, hey, where is your organ, man? So it will be a sort of public this one. And the person will be shy and he starts avoiding going to the public urinals, avoid going to the swimming pool, avoid wearing the shorts, because he feels that others are observing his crouch and they will comment upon the micro penis. So, yeah.
What is the cost of a penis enlargement surgery?
No, it depends upon the surgeon and the place he's doing. Anywhere between a minimum 1 lakh Indian rupees, it goes on. It can land up even in 10 lakhs also. Okay. So it all depends upon the surgeon and the penis which we are handling. If it is really micro penis, we have to do several times the surgery, the cost will go up. Okay. If the penis is already 6 inches, if you want 6.5 inches, it's very easy to do. Because the tissue is there, nerves are there, veins are there, just pull it, insert the tissue and increase it. So it's very easy to handle. A person who has got a good penis, to increase it, it is easy. So and the cost will be say something like 1 lakh, 1.5 lakhs, 2 lakhs, like that.
Okay.
So it depends upon where it is done, whether it is a 5-star nursing home or a 3-star nursing home or a single-star nursing home. Now the nursing homes are rated according to the star, just like hotel rooms. Say in some of the 5-star nursing homes, the room charge per day starts right from 35,000 to 1 lakh rupee. So per day, just like a star hotels. So if we stay 3 days there, about 3 lakhs is gone for this room stay itself in the nursing home. Like that, the cost goes up depending upon the rating of the nursing home.
Next
or
question.
The hospital. Yeah.
Somebody has a penis enlargement procedure. The penis, how long does it take for the penis to become fully functional after the surgery?
Usually 1 month. 1 month.
Okay. And
the function is not affected because the nerves are not touched during the surgery. They are spared. The blood vessels are not cut. They are spared. Only the spongy tissue is elongated. These the original blood vessels now they will be like that only. So erectile function is not affected. Only thing is because tissue injury is there, healing process has to be taken place. That takes at least 3 to 4 weeks.
Right, sir. So you mentioned about one side effect of penis enlargement surgery, which is erectile dysfunction. Are there any
possible?
Yes, sir.
It is possible. I said all will not land up in erectile dysfunction.
So
some unfortunate person may land up in erectile dysfunction.
Possible erectile dysfunction.
It is one of the complications of surgery.
Right. Are there any other side effects that you know?
Yeah, there are infections.
Okay.
At the site of this one, just like any other general surgery.
Okay.
Any surgery can have complications, infection, rejection of the whatever tissue we have put, because we have put the silicone shaft around the silicone shaft we would have put, and that silicone may be rejected, and we would have cut the suspensory ligaments. After cutting the suspensory ligaments, the penis may start hanging freely without getting proper erection. And the other thing is whatever the fat we would have put into the penis, that may get degenerated, it may get rejected. So all these and anesthetic complications may be there. So any surgery, it carries a possibility of some side effect. 1 to 5% is there for any surgery, and that is applicable for penile surgery also.
Right, sir. So you've got surgery, and then you've got other procedures like vacuum pumps and creams and lotions. So is surgery a permanent procedure, or is it also temporary? Will it shrink back to the original size?
Surgery is almost permanent.
Okay, sir.
Almost permanent. But of course, after 5 to 10 years, whatever the tissue would have put, that may get degenerated and penis may start shrinking. But surgical procedures are supposed to be permanent only, at least 5 to 10 years.
So how many people in India, according to your experience, come for, enlargement procedures?
Nowadays the awareness regarding the penile length is fast increasing because they see YouTube, Google search, and other sexy movies, adult movies, where they see the actor and actress, and they're all models. They are not. They don't represent the general population. They will be bestowed with a big penis, and only those who have got such big penis will be selected for such movies. And people will start thinking that, oh, all the penises are like that, only my penis is small. They come for the treatment. So the percentage of people coming for the treatment of small penis is increasing day by day. if you take into general population, about 1 to 2% of the men who have got a little smaller penis than the average, they come for the treatment because they know that treatment are available for this.
Is this a trend which is picking up in India also, sir?
Yeah. In India, I'm talking about Indian population.
And this doesn't have to do with movie stars or porn stars, but normal people.
Yeah.
Okay.
Because people now, the economics of the country has increased. People have got money. Now they want to have more luxurious life. So they definitely want better shape, better. They go for gym. They go for cosmetic surgeries. They go for whitening technique. They go to dermatologists for making their skin fair. Everybody wants Jamis look, so they want the Jamis color. Definitely, they go to the dermatologist for cosmetic purposes. Like that, even for private organs, they approach us to have bigger testes, bigger penis. So the trend is increasing, especially in metropolitan cities.
Okay, so one second last question. We talked about the PRP procedure where you talked about injecting blood, plasma, and bloodlet into the penis area, and it takes around 3 to 6 injections. What is the procedure like? These 3 to 6 injections, does it get injected within a period of 1 month or 2 months, or?
We usually give monthly once, one shot. That is called as P shot or PRP injection. We usually give one shot, and such shots we repeat 5 to 6 times. Even every month. Or if the person is in a great hurry, we inject every fortnight, once in 15 days, and finish off the 6 doses in 3 months itself. A person comes, sir, I have got married. In another 2 or 3 months, I want to get married. And in the first night, I want to show my partner that I got a big penis. So they are going abroad. Say, I will not be coming back to India for another 2 years. I want to. Or they would have come from other countries for this purpose only. They don't want to stay longer. So in such circumstances, we inject every 15 days once.
Okay, right. And the last question that I have is, the possible symptom, side effect of surgery was erectile dysfunction. Is there a percentage of men who suffer from this possible side effect?
Yeah, that's one of the side effects.
Is there a
one of the side effects of this surgery is he may land up with the flaccid penis, and one may land up with erectile dysfunction also. So the person who had good erection earlier, after surgery, the person may not get back the same amount of erection which you used to have earlier, because there is certain amount of tissue damage which you would have done by doing surgery.
Is there any research done to check the percentage of people who suffer from?
I am not aware, because I have not read any literature regarding this, and most of these surgeries are done by the andrologist or the sexologist in private institution. Usually such research will not take place because of the various reasons, because the people who come, they don't want them to be exposed, they don't want to give the real size and other things. So usually such statistics are not available. What I'm telling with is my own experience. Right. I don't have the statistics regarding this.
Right. Well, personal question. How is your farm?
Thank you, Jimmy. Yeah. So nice, Jimmy. You come out with very nice topics, and today's topic is really totally, I don't know what to tell.
It's fire.
Fantastic. And the one which is really required.
Yes, sir.
To educate all the doctors and also the patients. Yeah.
Exactly, sir. Well, how's the farm, sir? How's the organic farm?
Yeah, it's going on. You just drop in once. When are you coming to tell me?
I will let you.
Yeah, drop in one. Yeah. Yes. Or when are you calling me to the Calcutta? You tell me. So either one of the two things should happen.
Well, I say in Dimapur, Nagaland, so I can't.
Yeah, sure. Yeah.
But tourist people visit Nagaland in the month of December, where we have the Hornbill Festival, the first week of. But very cold.
Yeah, I'll try to come, make a trip there. Yeah.
Yes, sir. Well, thank you so much, Dr. Sharath.
Thank you. Good night to you. Good night.
Bye.
Good night. Bye.